Hi, how are
Hello,
you?
good and yourself?
Good, good. My name is Francie and I'm a student nurse at Texas Tech and I'll be helping you out today, okay?
Okay.
Alright. Can I just get your name and date of birth?
Yeah, it's Eric Cubillos, 6/19/1998.
Okay, Mr. Cubillos. So I'm going to just be helping you empty and change your ostomy bag. Is that okay?
Yeah, that's fine.
Are you okay in this position?
Yes, ma'am.
Yes. Okay, so at this point I would just ensure privacy, so closing the door and closing the curtains as well. And then I'm going to just be gathering my equipment. But first I'm going to just put on some gloves. So I put on my gloves. I'm going to put this waterproof pad on next to your side as well, okay? Just to make sure we don't spill anything.
Okay.
And then I'm only going to be exposing your abdomen.
All right.
So, yeah, just leave your gown like that. Okay. So, now, I'm going to just remove the clamp at the end of the ostomy bag and have my basin ready. Then at this point, I'm going to just turn in the end of the bag inward. And then I'm going to empty the contents of your bag. Okay, after that, I'm going to be cleaning the inside of the bag about 2 inches. And once it's clean, we can turn the bag outward again. After that, we're going to turn the bottom portion inward and then just clamp it again. We're going to want to make sure that the clamp is in curvature of the body. Okay, and then that concludes emptying. After that, we're going to just want to observe the stool. It's small, brown, and soft in consistency. Do you have any questions for me, Mr. Cubillos?
No, ma'am.
No? Okay, so at this point, I would remove my old gloves and put on new ones. So I'm going to just be gathering my new equipment. So this is our new ostomy bag with our new faceplate. And then we have our skin protection, some gauze, our adhesive remover wipes, and our measurement guide. We also have our clamp for our bag as well. So at this point, we're going to keep only the portion we need to work with, fully seam. So we're going to start at the top of the application, and we're going to hold the abdominal skin taut. And instead of pulling off the application, we're going to be pulling on the skin to remove the faceplate and the ostomy bag. So once it's off, if it's reusable, you can put it in soap and water and then let it air dry. But if it's disposable, then just toss it in the trash. Okay, so at this point, we're going to just remove any excess stool we see around the stoma or on it. And then we're going to use our adhesive remover wipes to remove any excess adhesive around the stoma. At this point, we're looking at the stoma to make sure that it's beefy, red, and moist, which it is. We're going to want to make sure that there's no signs of infection. Do you feel any pain around the area?
No, ma'am.
No? Okay, at that point, we also want to make sure that the skin around it is intact, which it is. Once we're done with that, we're going to use water and soap to clean around the stoma. Okay, so once it's clean, we're going to just allow it to air dry. We don't want to let any moisture get in there once we put on our new ostomy bag. So once it's dry, we're going to just put a gauze. And then we're going to get our measuring guide, and we're going to measure the stoma itself. So this one fits the stoma. So we're going to put our gauze back on. And then we're going to use the one that fits from the measurement guide to cut out our faceplate to fit the actual stoma itself. We're going to want to make sure that the faceplate or wafer, whichever you prefer, is at least 1/8 inch more of what the cut is. So we're going to just draw it on there and then cut it with scissors. So I cut it and now it fits the stoma. So before we actually put the application, we're going to want to make sure that the edges are smoothed out where we cut inside, because we don't want any rough edges when we're putting on the stoma itself. Before we also put it on, we want to make sure that we put our skin protector at least 2 inches in radius around the stoma. And then we allow that to air dry for about 30 seconds. So it's been about 30 seconds letting it air dry. We're ready to put on our new ostomy bag. So what we're going to do is we're going to put on the application around the stoma. And we're going to want to make sure to press firmly around on the faceplate for about 30 seconds. So it's been about 30 seconds. The ostomy bag is intact and on the stoma. The last thing we're going to want to do is put the end facing upward, and we're going to just clamp it. With the clamp, you're going to just want to make sure that it's in line with the curvature of the body. And that is the last thing we want to do. Do you have any questions for me, Mr. Cobios?
No, ma'am.
No, at this point, we're going to ensure our patient is in comfortable position. Are you in a comfortable position, sir?
Yes, I am.
Yes, okay. And then we're going to just want to get rid of any excess equipment or the stuff we used during this procedure, along with our gloves and any excess PPE. And we're going to want to make sure just to hand hygiene. And that concludes the end of my video.